All right, welcome back. In case you're just joining us, karibu sana to the program. We appreciate your time and company. It is Wednesday, and we shift gears now into the health and lifestyle segment. We have this every Wednesday, and we hope that you're learning wherever, and also how to manage the different conditions that you have out there. Of course, this morning, like I told you when we were starting the program, we are talking about hearing impairment. Some would call it hearing loss, especially when it comes to children. A tricky, age, if you ask me, because usually parents do not know when to tell whether something is wrong or it's just part of growth. But we have an expert in studio who will tell us when a child is supposed to be hearing effectively and how to tell whether something is off and what options are there to help our children to be able to live successful lives, whether they can hear properly or not. So allow me to introduce my guest for the show this morning. I'm hosting Richard Mwangi. Richard is a consultant audiologist. Thank you so much for creating time for us.
Thank you.
Karibu Citizen TV, as we talk about matters hearing and children. It's very tricky when it comes, an adult you can actually say, it's very tricky when it comes, an adult you can actually say, hauski vizuri, there's something wrong, you can actually notice. But when it comes to a child, especially the ones who have not started speaking, that becomes quite a tricky thing to detect. So I want us to talk about that. Let's begin by generally just talking about what your understanding of hearing loss or hearing impairment, for those who call it that, is, such that we can know what is normal and what is not normal, especially when it comes to children who hata wale wenye hawawezi ongea.
Good. Thank you for having me, and it's a pleasure to always be coming to this station and educating Kenyans on matters of hearing. In healthcare, especially for children, we talk about hearing as a result of congenital issue, that this child must be born with a hearing problem. And sometimes parents may take time to notice. But of course, like in other developmental process of a child, we talk of milestone. We talk of how the child is sitting down, walking. In hearing, we talk of how the child is responding to the sound. At 4 months, the child should be able to recognize some familiar voices, be calmed down by familiar voices. That's the mother, that's the father, or even the brothers and sisters.
That's at 4 months.
At 4 months, yeah.
Okay.
After 1 year, the baby should be talking, 1, 2, 3 words, though not so much audible, but you can tell, the child is talking about, dad said, mom, things like that. At 2 years, the child will be making some, 1, 2, 3 words sentence. So we're talking about when we say what you can look for at home to know that the child has got a hearing problem, are those pointers. The child turning the, when the name is being called, are they recognizing their own name? Do they know their own name? Those are the things, some of the things that we ask the patient or the parents who bring their children to our facilities. Does the child know his or her name? Because they are supposed to know their name, maybe around 4 months, 1 year to 2 years. Now, if those are the things that you don't find, the child doesn't turn, the child doesn't, recognize their own name, you're supposed to take some interest and see what is available locally, which can be able to give me some clinical screening, even before going to diagnostic. We talk of the screening. And when you talk of screening, this can be done even to a 1-month-old child. And why would they be done? We advise that whenever the mother had complication during pregnancy, or there's some treatment that was given, or we find that the pregnancy was such a not so good. Maybe there was high blood pressure during pregnancy, diabetes during pregnancy, some treatment of measles, some ailments. You find that this child might need the screening by 1 month. If the child fails, we repeat it after 3 months. If the child still fails, we do diagnostic at 6 months. So what are we aiming at? We are aiming at that this child who, the pediatrician suspect might have had a hearing problem or the developmental issue, or what you call congenital problem in matters of hearing, want to see whether there is a hearing problem that occurred during, the period of pregnancy.
Let me take you back a bit. you know, many parents would wait it out. They say that the child is still growing. Maybe someday they will start hearing, or maybe they will start talking at some stage. Yes. When does a child begin to hear? I've seen somewhere that even when the child is still in the womb, they can respond to some sort of external. So when does the child begin to hear?
That's not far from truth.
So that this thing of let's wait it out.
Yeah, that's not far from truth. Because you see, I've mentioned that a day one old child can do a hearing screening. Yeah. So the hearing should be there, okay, at birth.
Okay.
All right. So people say that even the child can hear when his the mother's womb. That's not far from the truth. But people wait. You mentioned about people, you know, wait and see attitude there. But that is wrong, because when the child is growing up, also should be able to develop speech. So what are the cases that we get in our facilities is that you are referred cause of a result of a delayed speech. Delayed speech can be among some other things, but more importantly is that the pediatrician would want to look at it from hearing perspective. You've heard people saying that if you don't hear, you cannot talk. Because all this, what you're talking about is that we have heard it and we develop the speech from that. So if you're not hearing, you cannot develop speech. And that's why we get, you know, the most diagnoses, the referral that we get from the pediatrician, the ENT doctors, or the family doctors is that they come with delayed speech. So investigate from there. And that will do, you know, necessary hearing tests depending on the age, because there are all types of the hearing tests that can be done irrespective of the age.
All right. So take us now to the understanding of where the problem is, because I know that there are different ways to manage hearing problems, and you can only get it right if you know exactly what the problem is.
Yes.
So before we even talk about the problem with the ear, talk to us about how the ear works. You know, explain it like you're explaining to a 5-year-old, because now we are talking to, you know, so that people understand how the ear works. And so that we can be able to understand where the problem is coming from.
Most people know ear as what we see. Yes, it is part of the ear, what you call the outer ear. But then the whole journey of the 3 parts of the ear. So what you see, we call it as an outer ear. Then you've heard people talking about eardrum, or what you call tympanic membrane in medicine. And then there's another part called the cochlea. So those are the major parts of the ear. So all those parts can have problem. And that problem can affect how anybody or even a child is hearing. Maybe this developmental issue of the ear canal that needs to be operated, and ENT takes care of that. Maybe there's fluid in the ear, where we say that it's not the fluid that if you bed like that, it pours out. It is in the middle ear, where we say that it's the eardrum, and there's a ossicular chain. You've heard of people saying the smallest bone in the body, they're found in the ear. So there are 3 of them, called malleus, incus, and stapes. So there they can develop fluid. And then, of course, it's treated. Now, the most cases of the hearing problem happens in the inner part of the ear.
Does the fluid have the same impact as the wax? Because also that's the earwax.
Yes and no. So the earwax, it's very important to be there. Okay, we always, if we look at the ear and you see there's this what you call good wax, and there's what you call impacted wax. And impacted wax can be as a result of you know, human activities of using Q-tips, or those you know, the cotton buds, because the more they do this push. But then we talk about the fluid, it is in the middle ear. So the middle ear, that has to be treated either by antibiotic or insertion of something we call grommets. So it is yes and no, because they cause something we call conductive hearing loss. Conductive hearing loss is not permanent. It is just where the conductivity of the sound to go through the system from outer ear, middle ear to the inner ear, it's somehow restricted by either the fluid or the wax. So
the outer ear collects or gathers sound from the outside environment. Then it has to pass through the middle ear. So the fluid or the wax can sort of like block in certain cases.
That is correct. That is correct.
That can be rectified.
That can be rectified.
So it's an artificial kind of situation.
Either by cleaning the wax, if the wax is there, and either by treating. But how will you know what you're dealing with? Earwax is simple. You just look into the ear. Nowadays, you can even have a patient look at what you are seeing also, the video otoscopy. So you and patient, you're seeing the same thing. So it's not, just the matter of looking and telling patient, oh, there's a lot of wax. Even the patient themselves, they can see they're quite accumulated wax. That you can see. Now, when it comes to the fluid that you might not see, you'll have to do some test, a test called tympanometry, from the word tympanic membrane. It's just to measure the impedance at the middle ear, or how the middle ear is functioning. We talk of the flat. When it's flat, we talk of otitis media with diffusion, or what you say, blue ear. And then you send them to their pediatrician or the ENT doctors to take care of that. Now, if that's another problem, we do diagnostic assessment and see now the severity of the hearing problem, depending whether it's a child or an adult, because the levels they're the same. So you want to see whether this child is hearing within the normal decibels. Decibels, the measurement of the hearing, and at all frequencies. You want to see if it's not there, is it a mild case of a hearing problem? Is it a moderate case of hearing problem? Is it a moderately severe? And the worst case scenario is profound, where you see somebody is deaf. So you want to carry out all those tests and determine where the problem is coming. All right. So
it could range from moderate to deaf. They can't hear completely.
From mild to profound. That's how the graph. Yes. Okay. Yes.
So let's talk about the inner ear. There's this interesting arrangement of where even the ear, there's communication even to the brain, and that could not be working properly, and that could also cause hearing problems. Talk to us about how that works, and in the event that there is a problem, what could be the problem?
Good. Now, in the inner ear is a snail-shaped organ which we call a cochlea. Okay, this snail-shaped organ have got hair cells arranged, high frequency, mid frequency, and low frequency. So when we are doing all these tests, we want to see where the problem might be originating. Is it a high frequency hearing loss? Is it a low frequency hearing loss? Or it is general, what you call sensorineural hearing loss, depending whether it's mild or moderate. Now, what we do if we talk about the children, is that we perform different tests. You see, the traditional test is not where you put the headphones, and you give the education to the patient. When you hear the sound, you press here. When you hear the sound, you press here. And I repeat it several times. That's very simple. But for children, you cannot do that because they are not understanding even those instructions. So you'd want to do more advanced tests that we normally conduct, and different. I would want to start with a screening we call distorted product autoacoustic emissions. So what you do is just to get a pass or a refer. Okay, a pass can mean that this patient is good to go, good hearing. Okay, a refer can mean there's a hearing problem, or the room was a bit noisy, or the child, because being a child, will also be a bit nervous, was making noise, crying, can be repeated. But there's more advanced one. There, the child is made to sleep, and naturally, we normally conducted a natural sleep ourselves. We don't sedate children, so that one is.
So you wait until the child.
No, we give an instruction. I know it's difficult.
That's a difficult thing.
We give an instruction to the parent. One night of a kesha at home it's not too much to ask for the betterment of the child. So you ask them. You can just let the child not sleep. When you come to the center, feed the child well, dress the child warm, and then within no time, because they'll be full, they'll be a bit exhausted, they sleep. It is not painful at all. The reason for making this child sleep is not to have artifacts or some quite of child moving or muscle movements. All we want to do is stimulate the cochlea and we call it a Bera test, or brainstem evoked response audiometry. So that's basically what we do, so that we can be able to give a conclusive report that if anywhere in the world it's done, be more or less the same treatment approach will be done. Now the treatment approach also depends. Although the child might be hearing, then you refer back to the pediatrician and to be dealt with other things, or the child might not be hearing, and then you start the rehabilitation and intervention program.
When it comes to hearing, just explain to us in depth, it's not just about hearing sounds. The ear has to help you also differentiate the different pitches, and also, send signals to the brain. so that you can be able to tell the difference between soft sound and the different sounds.
Yes.
And the hearing problems also come with these different, varieties. Just explain to us, how also that works for us.
That's a very good question you ask, because you remember I talked about high frequency, mid frequency, and low frequency. So we test along that those sounds. So what are we looking for? We're looking for to where the speech, because the speech is made of vowels, consonant, different tones, different voices, male and female. My voice is not like your voice.
Yes.
So you will find that some patients will say, I understand him very well when he talks to me, but I can hear you, but it's not audible. I cannot really understand what you are saying.
Soft sounds I can't hear properly.
Yes. So you say that they say that the sound is muffled.
Yeah.
Okay. But when this person talks, I mean, I can hear very well. So one thing about the hearing is a very quiet, let's say, let me call it an impairment. So what happened is that you don't know about it yourself. You have to be very keen that you're having a hearing problem. Rather, most of the patients that we see, it's their relatives have told them, their wives, their husbands, their children. So I mean, when you listen to the TV, it's a bit too loud. But when you're all alone, when we talk to you from behind, you don't respond to us. Or you said yes this time around, but now you're saying no. Because you see, it is that you're not hearing very well, but somehow you can hear, that's so-and-so talking, and that's so-and-so talking, but you cannot really understand. It depends on what type, what frequency is somebody affected. The speech, the pitch of the sound, where is it having a problem? And just to make sure that you're getting correctly, for adults we do what you call pure tonoaudiometry, we listen to the sound. And for the children, we'd like to do more diagnostic assessment, as I was telling you, the Bera test, so that at least we can know where are you missing the sound and what kind of intervention is needed. Because we say hearing impairment is not standard. This patient's hearing impairment is not this patient's hearing. Even if people are twins and have a hearing problem, this person's hearing problem is not this person's hearing problem. So it has to be very personalized in matters of how the approach is after doing the test. All right.
You've said so many things, and I just want our viewers to go with us step by step. So in the types of hearing problems, we have there sensory neuro, and the other one you said conductive.
Yes.
Is there any other type?
Mixed. Both of them.
Okay, so just explain generally what both of them, the difference.
Conductive hearing test, hearing problem is that it is just maybe the ear canal is blocked by wax. So the conductivity of the sound is not reaching out to the inner part of the ear. So what that means is that the sound goes through a journey of the ear from what we see, through the ear canal, where the wax builds up, through the eardrum, middle ear, and to the cochlea. So if there's a problem from ear canal to the middle ear, that is conductive hearing loss. Okay? Now, beyond that, where we say the cochlea, you've talked so well about sensory neural hearing loss. That's where we talk about it. Because it is something we call, we want to say it's nerve deafness. Okay? Okay? But then we have to rate it. Is it mild? Is it moderate? Is it moderately severe, severe or profound? So that's why I'm saying hearing problem has to be tested so that you can classify it. Now, the mixed is combination of both. This patient might be having maybe a perforated eardrum. Because even if the eardrum it's there, but it's perforated, there's still a conductive of the sound issue. You know, the eardrum is a well-stretched membrane, that like now when it's talking, it vibrates. So if it's not doing that, the sole job is supposed to be doing, then you find that there's what you call conductive hearing loss. It can either be operated, or you find that in most patients, the doctor will say, start using the hearing device. That will help you much.
All right.
Yeah.
So there you go, like it can be both.
Yes.
It can be conductive, sensory neuro, or both.
Or both,
both.
Yes.
And management depends on the
management
types of. We'll talk about management in just a bit. But you mentioned, congenital hearing problems. This is a child who has been born with this problem. I just saw somewhere a question that I wanted you to ask you. Can a baby be born without the auditory nerve or a small nerve?
See, like any other development during the pregnancy period, that might fail to develop fully. And that's why you find that when you talk about congenital hearing issue, that is what you're looking for. Was there developmental of hair cells in the cochlea?
Okay.
And if they are, were they at 100%? Are they normal? If not, they are not normal. At what level are they? Are they mild? That's what starts classifying the problem from there. So the approach also for management is different.
All right.
Yeah.
So the hair cells, some can be in miles, it means some are okay, some are not okay, and then it goes like that.
Yeah, you can be normal or different now.
Or different.
Can be mild, moderate to severe, and those levels up to the profound level.
All right.
So when you talk of profound level, you say that this more or less, this child is deaf. But if diagnosed early enough before the age of 4, because we want it to be done as very fast, the child can be helped. This intervention can be done, and I like the way we are moving, although it's moving slowly, but we are appreciating that children can be tested at any young age, so that if at all there's any intervention that is need to be done, can be done enough. This thing of delaying is causing so much of trouble, because from about 4 or 5 years, you know, we may find people looking for intervention, but it cannot be very successful. But if it's done early enough, at around 3 years, 2 years, even 1 year. Remember I said there's something called 136. So it means that a child can be diagnostically, or it can be concluded diagnostically that this child has got moderate or severe sensorineural hearing loss, and intervention can be done at around 6 months. So what that means? It means that this child will develop speech with the peers, with the age mates. It means that this child will, after developing speech, will go to normal school. It means that this child will live more or less a normal life, hearing with others develop. No, there's no speech delayed. But you find, you know, people delay so much because of some meds. You find that people saying, you know, the uncle of this guy talked when he was 10 years, which is a myth.
Yeah.
Those are not facts.
Yeah.
So we're encouraging that if it can be done, and if you suspect that there was problematic in pregnancy, high blood pressure, diabetes, all those things, it is very simple to screen a child. Very simple. It's not a whole day in the clinic, because we don't like wasting time of parents. So we come, prepare the child as guided, and do the screening within 15-20 minutes. You have your results. 30 to 45 minutes, it is explained to you, and you're good to go. You know what you need to do. If there's an intervention, you're guided through, and you've seen working. For more patients who like it, more parents who want their children to be diagnosed early enough. Yeah.
Quite unfortunate. I don't know how many though come, because let's look at that. What's the traffic looking like? Is there awareness? Is there, because like you say, a majority still feel like peleka mtoto pole pole, you know, maybe someday they will. So I'm sure what you're talking about is the population that have actually taken the trouble to bring their children to the health facility to be checked. There are quite a number of children who are still stuck at home without even knowing that there is a problem to start with. Yeah?
No, that's very interesting. And you see, let me tell you, I've been to practice for close to 20 years now. Now, I'll be able to answer that question very well. But what you see is that the last 7 years, you're finding people talking about hearing impairment, even on national TV like here. Some years back, it was not even close to that. Reason is because people are getting to know that this subject is an interest to everyone. And every one of us, we can be a subject to the problem. So, because we'll get children, or rather, even us, we can get a hearing problem at a certain age. So, when I started seeing patients for the hearing problem, I remember there's a child I saw. So I'm close to 20 years practice. So that child...
20 years, you say it like it's just yesterday.
Yes, because I want to explain
this It doesn't look like you've been in practice 20 years, though.
Because I want to explain this part. There's a child I saw when I started practicing. I think she was two and a half years. That child, she's about 22, thereabout now. She is studying aeronautical engineering in South Africa.
Look at that.
And she's severe to profound. That means if she removes her hearing devices like that, she can't hear you. But when she has them, she's doing very well.
And she's successful in
She's
whatever
successful,
she's
yeah,
doing.
yeah. And she's independent there. She's with no parents. She's by herself doing it. So those are the success stories that we want to hear. It gives us a lot of encouragement when you hear such a... Every time they are holidaying, like, this Christmas period, they'll pass by and say hi. Just to say hi, make sure that everything is working well. So from about 7 years from, we are getting quite a traffic coming in.
Yeah. Because of awareness.
Because of awareness, we're trying as much as, Audiology Society of Kenya to do it. We are trying as much to talk about hearing impairment and what can be done. Remember, it is, if you come and sit there, or a child just quietly sleeps there, no talk, maybe cries here and there, you might not know whether hearing problem. So we are talking of these pointers. At 4 months, this is what you expect. At 1 year, you expect this. And you find that also people go online, thanks to the internet and today's technology, that they would want to see the developmental process of their children, apart from hearing, among other things, so that they can see, where am I missing? Is the child good to go? And you're finding quite a number of them, about 1.5 years yesterday I saw, looking for help. In fact, they're not being referred by somebody. They say, I think, when we talk to him, when we try to call him, he turns sometime, doesn't turn. And you'd like to understand, they want to have clear mind. Is the hearing okay?
All right.
Yes.
All right.
Yeah.
You talked about the children who are born with problems.
Yes.
Can it be acquired?
Yes. Yeah. So we talk about congenital hearing impairment and acquired. So what does it mean? Acquired is where you were born hearing, everything's okay, and then all of a sudden you find that there's issues with the hearing. It can be acquired through different things. One, ototoxic medication. Okay, some medication that are given, they're given for good reason, to treat what they're supposed to treat, and they treat successfully. But then again, you find that they have that side effect of having a hearing problem. But I would also discuss about noise-induced hearing loss, because that's a serious thing, and that can be prevented. That can be prevented. That kind
of... Is it like through the gadgets and the loud music, or... Through
the gadget. Through the matatu industry, and I'll talk about some patients I've seen from matatu industry, where a case that, the driver is seated here, the passenger is seated here, and then the driver is told by the passenger, shukisha pale mbele. Then didn't hear. Yeah. And you see the passenger, what the passenger thinks is the attitude of matatu, which is,
Oh, they can't, like, innocently they didn't hear.
They didn't hear. Innocently they didn't hear.
They didn't hear.
They didn't hear.
Yeah.
And you're trying to explain to the passenger, I didn't hear. So if one of them came to us so depressed and say, this is what is happening, because we have to take the history of the patient and how did you know about this problem? Or we take the whole story. So noise-induced hearing problem can be prevented. And if you get noise-induced hearing problem, it is not reversible. You have permanently damaged your hearing.
Oh, okay.
So if you can prevent it, and the recent years is WHO has been talking about what you can prevent. And how can you prevent it? One is, if in call center, you talk about 60-60 rule, okay? You can take a break of the headphones. In the matatu, you need to entertain your clients. We understand.
They say, if it's too loud, you're too old.
It's a very unfortunate statement.
Ukisema punguza, if it's too loud, you're too old.
It's a very unfortunate statement. Yeah. Because why? We're getting even the young people having a hearing problem. You see the way they had stigmatized hearing problem of the aged. It is not. We have people who have acquired, not born with, who have acquired hearing problem at an age of 22, 23. Then you ask, how is this? You see, they want to listen. Nowadays, there's all matter of many devices that you can put in your ear. So they want to listen to your favorite FM stations. Well and good, but make it manageable volume. That if you're walking on a pedestrian walk, you can hear a motorbike hooting or a car hooting. There's unfortunate cases of where you've had people using their headphones, noise cancelling. So they are not interrupted, the noise outside. And some years back, there was a case of a plane crashing on someone because they had their headphones on. It was all over the news back some years. The social media was not so much back then, so that's long I've been practicing. But it was there, and if you look at it on internet, it's still available. Yeah. So those are the things we're talking. Use it. Yes, we understand. You want to listen. You want to keep up with with Kenya politics, which are moving very fast. You want to know what is happening every other time. So listen, yes, but make it manageable. Even some devices, some of the phones, because most of them are using the phones, they have got some meter, what we call, it's like sound level meter. Say like, if you go there, in fact, even when it warns you. Yeah. So don't go beyond that. Yeah. There's a reason that has been done.
And it reminds me the habit parents have, just giving their kids a gadget, unampatia headphones ama earphones, so that they don't distract you, so that they are busy on that gadget, you do other things.
Yes.
And you're not sure volume iko wapi. Like, they can even increase the volume themselves. So as a parent or a caregiver, it's also good that you monitor.
Yeah.
When your child is having that gadget. I don't know whether it's even advisable to give children earphones.
It's a good topic you've brought here, because have you heard of something that people are calling screen time autism? Yeah. What is that? You know, just the way you've put it correctly, that parents will give their children gadgets to have them and, so that they don't disturb. It is not a very good practice. Yes, don't deny them, but also limit it. Why? Because they'll know how to interact more with that cartoon than how we interact like the way we are talking.
In real life?
So they will not have a real life conversation. Yeah. So those are another cases that we are also finding. And ask, when you're taking the history, you ask the parent, how many children are there in the house? Say it's only one. Who is the caretaker during the day? The house girl. How is the day like? You see, because the house girl is busy, you switch on the cartoon and watch Cocomelon.
The whole day.
The whole day. So at what time would this child know that you're supposed to talk to me and I respond? Watching is one way. This child is getting entertained, listening to the sound. Might not necessarily have a hearing problem. Get to know how to relate with that. So that's the problem also we are having. Some of the parents, after realizing that kind of mistake, they are going and removing the TV from their walls, lock them in the bedroom, and give the child an interaction.
Yeah.
About the toys, you've also seen some toys written, the toy produces too much noise and precaution should be taken. A very small disclaimer somewhere. So also some toys produce so much noise. You don't want to expose this young child to that kind of noise, because we've talked about noise-induced hearing problem.
Yeah.
So that's a serious topic that need to be taken care of. Among other things, we saw back in 2022, there was a fight of noisy in places, entertainment joint, other places, worship places, because we take precaution that this noise can be being exposed to some people who might have other issues, and you're increasing the problem more.
All right.
Yeah.
Let's talk about management of the different problems.
Yep.
What options are there? Just run us through what options are there and what factors are considered to decide whether I need a hearing aid or a cochlear implant, or an ear tube, whatever. Yeah.
Before I go to management, I want to just quickly finish up on the few things of acquired hearing problem. So we talked ototoxicity, some medication that are given and can cause a hearing problem. This can be even quinine, which is not commonly used nowadays. You've talked about also noise-induced hearing problem, exposing ourselves to noise. Now, other things is age-related hearing problem. It can be hereditary. The family, we have this kind of problem. And also, say, a hearing problem of age can be from about 60 going up. And then again, not everyone. So those will be the main things where you talk about acquired hearing problem. All right. The management of those hearing problem. One, conductive, it's very simple. If it works, let all see, including the patient, see this is what is blocking your ear. Let's first of all clean it before we go do anything else. Right. And most cases when you clean it, some patient will say, oh, I can hear so much. I can hear even my own breathing. Because some of these things stop making, they don't make a lot of meaning when you have a hearing problem. when you clean the ear, it can be simple as that, cleaning the wax. And we clean the wax which we are seeing. We don't clean for the purpose. And you can look in the ear and say, that's okay, that's an okay wax. But when you look at it and you see you cannot see eardrum, it's so impacted, it has to be cleaned.
So it's not good to just remove earwax because you're seeing it. And for this one, I'm talking to parents. Kuna kuanga tu na ear, hizo cotton ziko tu standby. Ukiona tu wax kidogo, remove. So it's not advisable. Just don't remove for the sake of removing.
You know something interesting? Those earbuds, those cotton buds, is that they are written somewhere. They are not supposed to be inserted in the ear canal. Just check any brand. We don't want to mention any. But just check any brand. They are written. And by law, they are written. So what you're supposed to do, just clean what you can see outside the ear canal. The skin inside the ear, it's like a conveyor belt, so it pushes out the wax. So we say the ear cleans itself. So the business of putting, Q-tips and those sticks, see some other people using even khakis. It's very unfortunate because it can be also very tragic. Yeah, exactly. It can be so tragic that you forget that you're putting something inside the ear, and then you lie, because we have seen those cases where somebody just forgot that they had something in the ear, then slept on that. What do? They perforate the eardrum. Now it's turned out to be something so serious and which can be avoided, which is not supposed to be done at all at the first place. So clean what it is there with just a bathing towel. The rest, leave it.
Okay, you've talked about the wax. Let's now talk about the different.
So the wax can be cleaned. If there is the ear infection or perforated eardrum, because it can be perforated for various reasons, let it be handled, either operated by an ENT surgeon. If the ear infection can be treated, because all those we say they cause conductive hearing loss. Now, when it comes to the sensory neural hearing loss, where the cochlea is affected, is that we look at the severity and we look at the intervention. So hearing, we said, is not standard. Hearing impairment is not standard to everyone. So we look at how bad is it? What kind of intervention? Today's technology has really changed. I saw the photo that you put on the screen there. I was like, that's a wrong photo at this age and era.
Oh, we've moved.
We've moved from that. It's no longer the big, beige, black thing. That's not good.
Reminds us where we come from.
Yes, this should be somewhere in a museum. Because I even didn't get this one when I started practicing 20 years ago. So I saw that photo and I was like, oh, okay, fine. I'll go and tell them. So the hearing has moved from that to very discreet. And so many people are wearing it and you cannot notice. I normally say, because there's a stigma associated with hearing impairment and use of hearing, there's only two people who will know that you have a hearing aid. A fellow user of a hearing aid. So this is a patient who has a hearing aid.
And they know how it looks like. And
they've got interest in ears. All as audiologists who our work is looking to ears. When was the last time you gazed at somebody's ear?
Well, I can't really tell.
That's the thing.
I can't tell.
That's the thing. And the hearings have become so discreet. So we look at the severity of the hearing problem and look at the most discreet hearing aid, and then the technology. In the hearing healthcare world, you're talking of artificial intelligence nowadays. So the hearing that studies your hearing surrounding and trying to make it manageable to a normal or closer to normal hearing that you used to have. Yes, they cannot replicate natural hearing. That you agree. The hearing aids cannot replicate the natural hearing, but will give you more or less of 90% of what, which is okay comparing to where you're coming from. If you can hear 90% and you're just about hearing about 10 or 5%, that's okay. And then they also depends on the severity. Now, for the children who have got severe to profound, there's criteria, because we're looking at this child to have so many years to develop speech, to achieve so much in life, and to compete with others economically, if it goes to political, that kind of thing. We look at it very keenly, that we have to say, follow it closely, that if we give this child a hearing aid, we need to see this child after 1 month and see how is the improvement. Are the parents seeing some improvement? So when it is severe to profound, is that...
So improvement should be in terms of even their speech, their behavior?
See, this child has not developed speech. That's the reason, first of all, they came. So we want to see, is the child turning whenever there is the father talks, the mother talks, or when the siblings are playing, is the child. And we're talking about a very young child by that time, maybe about 6, 7 months old. And if not, 3 months is enough to make a decision whether to go to cochlear implant. And you should not delay this child anymore. If that didn't work, if there's no improvement, we go the cochlear implant way. Because what it means that this child cannot benefit from the hearing aids and need to be operated.
What's the difference between how the hearing aid works and the cochlear implant?
Good. It's a very good question. The hearing aids, we rely on what you call residual hearing. So this person has a hearing problem, is it? But how bad is it? Is it mild, moderate, moderate to severe, severe? Up to severe, we can work very well with the hearing aids.
All right.
Very well. Cochlear implants, they are implantable. You implant them. They are surgically implanted. So they go to that organ, you are saying the snail-shaped organ. They are implanted and to, replace or to try to imitate what a natural hair cells should be working, so to say. So that is the that's the most complicated procedure to do, but to benefit this child. And again,
that is in the event that the hearing aid is not helping this child.
We talk of candidacy towards the cochlear implant. One thing is that the child must try hearing aids first for about 1 to 2 months. But on a close monitoring, because we don't want to delay any process. We're looking at the future of this child, how, should go to a normal school. And then, remember I said, this has to be done before the age of 4, 5, if you want to have very successful results. And those, because I've got a couple of patients who have done that, I mean, you see the children are doing very well. They're extremely doing well.
It's quite admirable if a child can live a normal life regardless. And it's actually possible. You don't have to leave a child to grow until he's an adult, she's an adult, she can't hear yet. It is something that could be rectified. They could have a normal life and pursue their dreams like the lady you were talking about. So, let's look at the cost implications, because that's where the problem is. Averagely, how much does a hearing aid cost in Kenya? And compare that to now graduating to an implant, a cochlear implant.
Now, when we talk about the costing of the hearing aid, we also talk about the technology level. I'm sure today's world is that we have phones, and we know you can have ABC made phone or different levels. You talk about standard level, pro level, or max level. So the hearing aids also comes in different what you call different levels and different standards. So you find there's a basic hearing aid, which is also very good. And for some cases, you can find that there's also essential hearing aid, which is good. But what you talk about is that if you can get, or you are able to get, quite a premium hearing aid, it helps. Yes, it helps in understanding speech, and also that comes all those AI, artificial intelligence features, which helps this person to get to about 90%. So what do you mean the basic hearing aids is that this is the hearing that if somebody with a severe, or let's say even some profound cases, they can be able to localize themselves. Apart from hearing, we hear and we take it for granted. But when somebody who doesn't hear will not say or will not tell where the sound is coming from, is it right, left? So this basic hearing can tell somebody giving a knock, some car hooting behind, because those are the sounds that people. You and I will just try to imagine how it is, but in experience, the people with the hearing problem, they're the one who has experienced this much. So those basics will just help that much. But in development of the speech, where you need this child to develop speech, we need this person also in adult to have normal hearing, or just try to make it to about 90-95% where they're supposed to hear, engage their meetings, interview like this, just lead a normal life, do their whole job that they normally do. Is that we want something that can be able to help them much more advanced. So they depend. The costing also depends on that.
All right.
So some years back, not even some years back, up to I think this year, the NHF used to buy for hearing for some patients, especially in the civil servant. You're still trying to see how work out with the current one.
I don't know. They say that they're going to include it in the Social Health Authority. I don't know. We're still confused about this thing. So we don't know.
We have not seen any patients at the new
since the transition.
Since the transition.
But it was supposed to be just one in a lifetime, and for a child who is below 18 years. That's what the former CS said in one of the forums I attended when they were discussing this transition, that it was one device per child in a lifetime. I don't know, do they need to change it after some time?
You see, I mean, allow me just to say this, because you see, we have 2 years. Why would you give one person one hearing it, whereas, God in his own wisdom gave us 2 years. And this person might be having 2 years which is affected. So it have been consulted widely. Why would you want to give only one? Because you want this child to go to school. We say hearing is directional. Then this child is having, maybe sitting on this corner, the teacher in this corner, and having this device on this side. How will it benefit this child? So
and after they're 18 and above, what happens? What if they need to replace it?
Even the worst case scenario is that when you use one hearing aid, in some countries you have to sign a consent. Okay, it will be said as mismanagement of a patient when you don't guide them well. So when the patient has got binaural hearing problem, or a child has got a hearing problem in both ears, you're supposed to do fitting of hearing aid both ears.
All right. The cochlear implant.
Yes.
This is quite expensive, millions of shillings. I don't know. How many Kenyans can afford that?
We would want to talk of the quality of life.
You cannot. I'm seeing what you're doing. You're trying to run away from the cost.
I'm coming there. We'd want to talk about quality of life. You see, even when...
Where does a woman in the village get 3 million to help the son or the daughter get a cochlear implant, if that is what they need?
You seem to have an idea of the cost, but I think it's about 2.5 of the cochlear implant. But we look at the quality of life. Do you want this child to have a hearing problem, to be seen as a rude child in class, to not perform well in class, and then they're still growing? You want them to be dependent. You want them to, to relate with your business, to relate with what you do, to see them successing. Because a generation should be, like now, I would want my son to outdo me. Okay?
Be better.
Yes, to be better than what I've done. So that's what we look at it in a human perspective. So we look at the quality of life. What do I want to give this child? Okay? How can I achieve what I want to do? Now, the National Council of Persons with Disability helps to get some people who has registered for hearing disability get hearing aids. Even if what kind of the hearing they're getting, but you find that it makes life so easier.
It's true.
So another thing I would like also, to talk to our viewers is that if you've got this hearing problem, the child has got hearing problem, let them be tested through the government facilities, through where we are, and then submit the results to the National Council of Persons with Disability. They listen. It's just because people don't know much about the hearing, and that's why we come here to talk about it, to education so many people about it, and have this advocacy continuing so that we can have people getting help. And that's how we'll manage people with hearing disability very well.
All right, and it's good that you've said that, because one of the conditions for one to be a beneficiary of even the National Health Insurance for assistive devices, then you have to be registered.
Yes.
It has to be a disability that has been registered under the National Council of Persons with Disability. So it's not just you going there and saying that you have a disability. You have to be registered and you show that certificate. That's when you can benefit. So
that's true.
It's good that you've said that. Let's wind up, just give us your final shot. Maybe talk to parents. A word of caution in handling these young ones.
Yes.
Just so we can save their futures when it comes to hearing.
Yeah, so hearing is very important, and that's what connects us. That's how we know where to go through instructions. It's as simple as that, we listen, we understand, and we act. It's through hearing. That's how important it is. So if you don't hear, you may be taken as a rude person, because I may talk to you, you don't respond. So what do I imagine? Because I cannot see any other problem.
You're ignoring
me. Ignoring. So if parents have got children with a hearing, children have got, you have interest, you know how the pregnancy was, and you think that it is good to screen. It doesn't cause any side effects to screen a child, because they're delicate and you'd want to hold them like that. Yeah. So it is not an exposure of any rays or anything that you'll be worried of radiation or something like that. Here we talk matter of sound. It is screening that is very essential, and you can have guideline on how to manage your child. If he's an adult, we would also want, if some people have complained in the household, like you have a hearing problem, get this checked, you keep on delaying. It's very important. And when we talk about the hearing, we talk hearing and brain health. It's something that is so closely related, or what we call cognitive function. So cognitive function is how the brain works in relation to how we hear. So at that point, we want to talk as hearing towards the brain health. Because if you stay for long, you've been seen to be having a problem, you keep on postponing this appointment to have your hearing test, to have the hearing devices fitting, the cognitive function is affected. The brain in its own wisdom tries to adjust itself. And that's where you find that people would want to see who is talking, because they want to use more of their eyes than the hearing, something we call lip reading. About the cognitive function, you find that we talk of cognitive decline, where the person the small tasks they used to do, they cannot handle them, where they become so forgetful, where they go to a place like a restaurant to have a conversation, they cannot have a conversation because they feel frustrated, because all they can hear is too much background noise. It's high time you don't run away from the problem, face the problem, and it can be very assorted.
Face the problem, it can be sorted. Thank you for ending it on such an optimistic note. I've been talking to Richard Mwangi. Richard is a consultant audiologist. We were talking about hearing problems when it comes to children, and we've learned a lot as a parent, as a caregiver. Knowing that your child has a hearing problem will not only help you know or understand how it impacts them, but it will also help you know how to maximize their potential when it comes to speech development, and even just helping them navigate through life so that they can live a normal, successful life just like the other kids. So face the problem, there are solutions. That's what we are telling you this particular morning. Thank you so much for watching Daybreak. My name is Safina Chieng Ouma. Keep watching Citizen TV. There's a lot we have lined up for you, but for now it's a wrap. Have a lovely day ahead.